everybody. Yours truly, Chris Burns, founder and chief executive officer at Peaks Recovery Centers. We are live at the 49th annual Winter Symposium, interviewing, you already know it, amazing professionals, but even better humans. Really excited to bring you the next guest today, Director of Quality and Compliance at Circa Behavioral Health Care, Maeve O'Neill, an amazing professional, but an even better human. Check us out.
All right. Well, I'm so grateful to be here with just a phenomenal guest, professional, and even better human being, Maeve O'Neill with Circa Behavioral Health Care. How are you doing today, Maeve?
I'm great. Thanks for having me here.
Absolutely. So great to actually have you in studio. You know, we had you on a couple years back. Brandon had you on virtually. And I just know when we get your energy in a place, the people, the audience can really connect with that, because one of the things that really speaks to me about who and what you are is authentic. And I'm so grateful to have you in here. We met Maeve years ago, probably 2016 or 2017, when we were going through our first Joint Commission survey. And it's been so cool to be not only supported through the Joint Commission, but also as she's moved into these other roles and really been dynamic and leading organizations into compliance, regulatory issues, and things of that nature. So what are you doing now for Circa Behavioral Health, and what do you love so much about it? You seem to have so much passion behind what you're doing right now.
Well, I kind of have to give you guys a little bit of credit for that. You guys are my last Joint Commission survey that I did, and I was moving on to my first role as a compliance officer for an organization. And to be able to go, having seen such a wonderful program, right, as a surveyor in this field for 30-some years, you see a lot of programs that are okay, you see a lot that are not so good. So to see people like you guys that are doing good work with good leadership and then serving clients in a good way, it's inspiring, right? And it made me want to do more of that and help more people do that. So what I love is that this field attracts people who are helpers. I think we come from families and communities that need our services. And with even post-pandemic, though, it's even worse now, right? More clients in need. There's more need for services. So we've got to find those people and build those services that are doing the right stuff. And I don't think it's hard to do that, but it's hard to find the people that care about it enough. So I'm hoping to find more of those people.
I love that too. You're actually bringing up something for me that I know we went through. We did a Dare to Lead training with you about organizational health. What are you finding within organizations? You know, we were just sitting in a talk that talked about organizational burnout, staff leaving, the great exit. What are you experiencing within organizations is so disconnecting right now?
Yeah. Well, I don't think it's that much different than the rest of the world, right? We know burnout is epidemic right now in every field. But in behavioral health, we just don't talk about it. I think because we're mental health professionals, we don't want to admit that we could be burning out.
Right.
I know when I was burning out in 2013, I didn't know what it was, and I didn't want to admit it. And then we have, I think, burnout is number one. I think next is turnover. When people are burning out in our organizations, then they're leaving or they're quitting or they're just sort of checking out and not doing the work. So then everyone else is having to pick up the slack. So then we're getting even more kind of under stressed and that. And then I think the culture gets impacted. You know, people are feeling stressed. We don't have the support we need. Leaders are feeling like, why isn't the job getting done? Why are people leaving? I can't find good staff. And we do a really good job of sort of blaming and shaming. Well, young people don't want to work today, or no one wants to come do the hard stuff, or and I just think we have to acknowledge that we're part of the problem as organizations, as leaders. We have to do something different in what we're bringing to the table, right? When I was burning out, I worked for an organization that I couldn't ask for help, and when I did, they said, "Well, May, do more yoga or something." I don't know what to tell you. It's your fault, right?
Yeah.
We hear about self-care a lot, and I don't like that term either, because I really feel like it has to start with the organization, with role models from the leadership, and then we have to have teams that do it in our daily work. You know, as a compliance officer, I think our job is to build in mindfulness and healthiness and ways that make us the daily work easier, and then we'll have healthy staff. We can't just demand staff to be healthy.
Yeah, that's so true too. And one of the chief causes of burnout is actually not naming it. Right. Not naming the issue.
Right.
Something that I've noticed lately is the teams coming to me and they're like, we're burnout, we're doing a lot of things. And our new clinical director, Pema White, stepped right in and she said, here's what we're going to do. We're going to get an administrative day. Each and every clinician can just close the door to their office, have a bit of autonomy, have the family picture there, turn on some classical music, and just do their administrative work. Whereas before it was very much a disconnected process. We see a client followed by another client, followed by another client, followed by another client. And then I have all this data entry and this note taking. And so it becomes really burdensome and really disconnected from the documentation from the session. And so we're finding just little implementations over the last few weeks. And that was one of them. I saw the staff, literally the clinical team, go, oh. And so what are you seeing on your side of things? Like, what are some of the chiefs of burnout? Because it's happening so much more now than it was 15 years ago, at least in my experience.
Well, I think the pandemic's part of it, right? We just know the world is under more stress. We're all a little more scared, a little more fearful, a little worried kind of what's going to happen. I think also we're setting better boundaries. Like, I don't want to work 12-hour days. I want to be home with my family. I don't want to be gone because, like, what if something bad happens? So that's part of, I think, the reality check of we all need better balance in our lives. Yeah. But I also think the clients that we serve are tougher. You know, they're more acute, they're more complicated. We got family stuff and medical and legal. And so, you know, when I started the field, we had different units for mental health or addiction, or the drugs were over here. And now it's all one client with all these issues. So I think we have to then look at the documentation, administrative issues, and figure out how do you make a clinician's caseload manageable, right, and their daily schedule manageable. So, and to me as a compliance officer, I think we have to carry some of that. Like, I love, in my job at Circa, as a fractional compliance officer, we can come in and take that off of you. I don't want anyone who serves clients to worry about compliance. I want to make it easy. It's in your policies, it's in your protocols. I do your quality meeting for you. You know, we're doing your performance improvement. Like, we make it easy so that the burden is off of people that are doing the direct line work with clients.
Yeah, that's a really big deal, and can really, like, alleviate some of that. I find some of our clinicians, especially in leadership roles, to the talk's point earlier, it was like a lot of these people in leadership roles are being pulled out of some of their day-to-day passions to sit behind a computer screen and data entry. And I saw some really good ways through using, you know, the advances within the technology space in our field to help support and counterbalance some of that intensity that clinicians face. And something that I don't often think of, you know, it used to be 15 years ago. I always talk to my brother about this. It's like, you get a gold star for never leaving the office. You know, you get promoted because, you know, and I heard things like, sleep when you die, you know, and anybody on leadership, or the people that work 12 hours a day, they never put their phone down. And I think we're actually learning that that's not the way.
It's not the way. I love when I went to my first compliance officer job, and I tried to help build that culture. And I was at our corporate office in Nashville, and we had couches and stuff in that room, and I was in there talking to someone, and one of the call center staff came in and laid down on the couch. And my instinct as a prior leader was like, aren't you on the clock? Like, should you be sleeping in front of the compliance officer? But that's what I told you to do. That's what I taught you is okay, right? And I was so proud of that person to do that. But we absolutely have got to change the mentality, right? My new mantra is, happy and healthy staff are ethical and compliant to provide quality and safe care. We can't just demand you to be a good clinician, a good provider, if we're not building the environment that makes it easy to be ethical and compliant and happy and healthy, because you have to have all three.
Yeah.
So that's my new dream, to help build that in organizations, that in the daily flow, in the expectations, in the supervision, in the leadership, it's all got to be there, and that's got to be the consistent message.
Yeah, I was thinking about your question before the symposium. I should have just said yes and scheduled that, because it would have been really nice. But as I've stepped in back into the CEO role over the last few weeks, what I'm seeing is that the work-life balance just isn't there. Yeah. And unfortunately, some people are working 71 hours, others are working 38 hours. We just don't have or hadn't had this efficient way to operate. And to your point, and to the talk's point earlier, it's on us as owners and providers to ensure that this is carried out. And one of the things that I'm telling the team, even though we're right-sizing the model and right-sizing stuff, we can be more efficient and we can take great care of each other and ourselves as a result. And so, but it has to start with me. And I was telling all the professionals earlier, I was like, I'm not going to work 12 hours a day. That's not efficacious for anything that I have going on, nor is it efficacious for the facility to have me here that long.
Right.
You know?
No, not at all. And I think too, it's sort of that mentality that we want to, I remember when I first went in the field, it was like first one there, last one to leave. That was kind of the mentality until I burned out, and everyone said, well, why do you do this? I'm like, well, I thought I had to, right? I thought it was expected of me, but I think it's really not. And I was in a session yesterday or on Sunday, and someone said, all this stuff sounds like fluff, talking about leadership and teamwork and resilience. It's like fluffy stuff. It's really not, right? We know from the research, the companies that take care of their people actually make more money. They're more profitable, even in other industries, right? If we take better care of our people, they will take better care of us and our clients. Therefore, you get higher census and longer lengths of stay and more money.
Yeah, you've probably even been met with the comment that, oh, that's a very privileged view.
Right.
Right. Or it's fluff.
Yeah.
It's similar to like family systems. And like when we say, you know, the way out is through, not just for the individual, but the family. So we get to do this. And a lot of times families are, okay, well, this is a very privileged view. We're all in a facility right now that tends to be very privileged, and we have the privilege of being here. We might as well take advantage of the opportunity to recover in a parallel way. That's Lisa Smith's quote, by the way. That's my friend. Reclaim recovery. And she developed the model that's parallel recovery. And it's built on this idea that the client goes through care, 6-week curriculum, the family does the same thing. And it turns out that maybe the need and E model isn't the most efficacious, and the family actually needs to go through grief week. Family needs to take a look at identity and purpose and really kind of healing from the outside in, both organizationally and individually. But I've heard that comment before with respect to some of these dare to lead. Oh, wouldn't it be nice if we had time to dare lead? You know, and we do.
Yeah. But that's, I think that's even to what your point is, like if we want clients to be recovering, families have to be in recovery. But I really almost think until we have systems, organizations that are healthy in recovery, we're never going to get that. Like, why do we think our staff don't need grief and loss and support and all this stuff? I just don't think we can expect our clients to be healthier than we are. And at this point, that's what we're asking them to do, because our systems are not healthy and our staff are not well, but we think they can give it to other people. So I think we're almost like making it worse because we're assuming they've got it because they've got licensure or they've got some experience or some title.
I'm sure you went through this class.
Yeah, exactly. You know, 10 years ago, I'm sure you'll be fine. But even as a licensed clinician, we never got anything about burnout or, you know, that kind of stuff.
Dealing with insurance companies.
Right, the stress that can happen and just the state of the world today, I think, is, as Brene Brown says, like we're just not well as a people, as a humankind. So I would love to look at behavioral health and think that we're leading the way in the well-being of our workforce and workplaces, and we're not. In fact, we're almost like denying that it applies to us, which is very strange to me.
It is very strange. Yeah, in organizational health, when we've been organizationally healthy in the past, we are just getting so much work done with individuals. People are feeling like seen, valued, and heard. And, you know, I've heard the story too. Like, you could be seen, valued, and heard somewhere outside of the workplace. People are here to work. What do you say to that?
Yeah, I've had the CEO once say to me, we pay them a paycheck, but what do they want?
Just like up a raise.
Yeah, crazy. But you think about it, we spend the most hours in our day at work, whether we're at home doing it or in a workplace. So the majority of our day is spent there. And if that is stressful or conflicted or, you know, tense or whatever it is, how can it be productive? How can it be helpful? And then we go home, you know, and then we're unhappy. So I just feel like we have to realize that if we're going to have, I remember early on, it would be like, you want to create an environment with your kids to be a healthy family, right? I mean, you've got your boys, like you want to have a healthy family. You can't do that just by chance. You put a lot of effort and work and time into it. But I think in workplaces, we think, well, it'll just happen organically. You have to put the same amount of work into it. Like you said, when I've done that work is when you see the results, you know, and you can see it. And it's so easy to drift. Like, oh, we'll do that meeting next week, or we'll have that team retreat next month, you know, we'll put it off. And then things happen and you don't get to it. And then you wonder like, oh, our census is low or incidents are happening or, you know, we've lost money. Well, why? It's probably because 6 months ago you stopped talking to your people.
Right. It's so interesting that you're talking about that now and kind of where Peaks is as an inflection point. You know, we're in some of the most, you know, again, right sizing and then going through, we're really busy right now. We got the conference going on and, you know, I just felt, you know, we had TJ out here and we're doing the conscious recovery thing. So he's coming into the team on Thursday and Friday. And like, we need to grieve. You know, we've lost some friends, both clients and staff members that were really big pillars at Peaks and they're not there anymore. And so like, we need to come together and build trust and talk about what's going on. And you would think that our industry would be at the forefront of this,
right? But
clearly we're not.
No, we should have a manual for it, right? I mean, in my ideal view, as a compliance officer that has a wholehearted view of the world, is there should be a policy. When our organization goes through these changes, what do we do? Well, we have team meetings, we have access to EAP, we have leadership meetings, we have a retreat. Like there should be like a protocol, like we do with when a suicide happens or when an incident occurs. Like there should be a protocol.
For every client,
we're not helping LA. But why don't we have that for organization? We just kind of wing it and hope for the best, or we kind of just push it aside.
I love that. It's actually giving me some ideas. It's like, we're going to have that protocol.
Yes, I hope so.
Because then we don't have to think about because crisis is going to happen.
Yeah.
Change is going to happen. Change is going to come.
Yeah.
It's going to be intense. We work in behavioral health.
Yeah.
Why not just know right away, hey, staff is experiencing burnout, disconnection, and some transfers. We just do A, B, and C right away. And from a safety component, just feeling safe and being able to settle in the workplace, I think that's a huge component.
Yeah. So my dream, I'm doing a doctoral program right now, and my dream is, my research is going to be about measuring burnout. If a place measures, do you measure your burnout? What does that look like? How do you know in your staff if Maeve's team is burning out? And then what's your turnover? I mean, that's an easy data. You know your turnover rate. Is it going up? Is it going down? What's happening? And then what is your culture? Is the culture doing well right now? And what if we looked at those numbers every month, every quarter, and then we did something about it, like you're supposed to do with performance improvement, right?
Yeah. We are.
You adjust. Yeah.
With you.
Okay.
Yeah.
We got to do it.
Absolutely.
And then we're going to develop best practices. Well, if your turnover goes up, you should do these 3 things. If your burnout goes down, you should do these 3. Like, I feel like we should have some good protocols and evidence-based practices, because no people are doing it out there. There's people doing a lot of the right things. We just got to pull it together and share it.
Yeah, no, I think that's so huge. And what that can do, like, just from an ecosystem, and I always go back to, like, Bessel van der Kolk's work and, like, the body key and the score, and, like, if I'm going into a trauma-filled, disconnected environment, how do I not bring that with me? And not only to mention that is sometimes we forget in this field that, like, with all due respect, our clinicians aren't construction workers. They're not hammering nails. They're sitting with some very, very heavy story, and they're engaged with those people all day long.
Yeah.
And so is the support staff. And so what are we doing to support them? Especially in our field.
Oh my gosh.
And so that's something I'm very, very passionate about moving into. And something that I've told the team as I come back in as a CEO is like, we're going to get this part right.
Yeah.
I don't have PTO. We're not going to cash out 40 days. We're going to use it. But we need to figure out policies, procedures, and processes to inform that in a very, very efficient way. And I think to your point, once we have that, the metric becomes very efficient.
Absolutely.
Very supportive.
Absolutely. I saw Bessel years ago at a conference.
No way.
And I went up to him afterwards and I said, I think I just had my son or my second child maybe. And I went up to him and I said to him, something happens to me. I don't know, it was a weird question. I said, Dr. van der Kolk, when I hug my children, like I feel like my body regulates. Although I don't know what it was. He looks at me and he goes, that's love. And I'm just like, holy crap. I've never felt that before, but in an unconditional way. So then obviously now I do with my children, but now why don't I feel that with my staff? Why don't I have love in an organization or with my team? Like love is the missing piece in our organizations, I believe, because we're traumatized, because we're not well, and because we don't have the right supports in place.
Yeah, I love that you say that. When I opened Peaks back in 2014, not only did we open the program with the Theodore Roosevelt quote, says nobody cares what you know until they know that you care. And we dumped that down into client culture. And I think over time we forgot to do that with our team in a very connected way. And I used to say things to like Jason Friesmas of the world. And when he started with us back in 2015 and said, this will be the best job you've ever had. Well, sometimes I still conceptualize that I'm living in a world where we have 15 employees and everything can be solved at lunch at my office, and we all have lunch and hang out and talk about our days while clients are, off-site at community-based resources. I told myself a story and then all of a sudden here we are in 2023 and we had 100 employees and no organizational wellness platform to inform our day-to-day operations and connectedness.
Yeah.
So it just kind of gets away from you real quick before you know it's like, we got to reel that back in and get back to the basics.
Totally.
And I love what you say too, because most people think, wow, that's not going to be cost effective. But all of your research and your experience, both personally and professionally, said that these metrics build all of that back into your company.
Yes. The data is out there. We know that there are Fortune 500 companies, that the military, there are places that are doing this and they're seeing the results. The return on investment is clearly there. Even in other countries are doing research that's showing that. It's like multiples of, it's amazing that we don't do it. But I think in behavioral health, we don't have the model for it. We don't have someone yet that sort of said, this is how we do it. This is what it looks like. So I'm hoping in my research, we'll be able to pull that and then we'll share that. And you can tweak it for your organization. It's not going to be like a solution that's going to fit everybody, right? Every team is different. Every leader is different. But there's going to be a toolbox of things people can choose from. Hopefully, I could try this. I can try that. This works for me. This doesn't. let's try everything and then see what happens.
Yeah, I love that. One more question. Do you find that, and I think this would be somebody, maybe some entrepreneurs questions, some providers, some ownership groups, if I introduce this model, does it create an ecosystem where people just complain all the time? Right? What do we do? People are going to complain all the time. What would you say to something like that?
Well, I think that was my fear too. I remember early on, I used to feel like, God, these people are so needy.
Right.
Knocking on my door all day long, like, God, I love you. I know. Until my staff said to me, Maeve, we need to be able to talk to you, and we can't. Like, we like you, we like working for you, but you are not available to us. Like, they actually I had created an environment where they would tell me that I wasn't meeting their needs. And I love that I did that, but I was like, well, I don't know what to tell you. Yeah, it's not going to happen. But until I got Brene Brown trained, I realized, oh, wait, it can be different. And when you let people feel seen and heard, then they will react differently to the tools that you give them. But it's got to be skill-based, right? I can't just sort of, if I join in their complaining, or I too am complaining, that's what you're going to have. And that gossip and negativity spreads very quickly. That's very contagious, right? But as Brene teaches us, so is courage and so is compassion. So when you do that, it's very different. And like my boss now, Devin Wade, is a perfect example of that. He is like the perfect organizational health leader. And every day he shows up for us. He lets me do Dare to Lead every Friday in our team meeting. So our whole team is getting trained. And every week he leads with vulnerability and authenticity. And we all complain to him, but he has this way of hearing it and listening to it and supporting us that just, you want to stop that. You want to contribute in a positive way. So I think that's our fear why we don't do it. But I guarantee if you do it in a skill-based way with the right tools in place, it doesn't become that. That fear doesn't come true.
I love that too. And it's so interesting you say that. I had the opportunity to go in front of our leadership and our clinical team as we're going through some of these changes. People are sad and they're hurt. And for the first time in 2 weeks, differently than meeting with the medical department, I felt like I could be authentic. And the room actually called for that. And that was actually non-negotiable. And as I moved through it, I started to see that through me letting down my guard and being where I'm at and maybe jumping down in the hole with them a little bit and be like, yeah, this sucks for all of us. I started to see a level of comfort and settling and safety. Now, we have to have the plan moving forward, which will support that. But you're so right. I've been able to see it throughout not only my own personal recovery journey, but my professional life. Some of those rooms, they just really demand authenticity for people to lean in and get down for the cause.
Yeah. I think sometimes as leaders, we think we need to be like the strong and the knowing and the like, oh, here's the solution. That's not what people want. And I think my children taught me that the most. Like, Mom, can you stop talking to us? Stop asking questions. Stop, let us just be who we are and just listen, and love us. And so my kids have kind of always been my teachers in that. And so I try to apply what they teach me to the rest of the world.
That's so cool. Yeah, those kids you're right. It is so important to be where you're at when jumping into this thing called parenting. And they actually don't care what happened at the office today. They want to know that you can sit there in these meaningful moments that matter. And we do. So to transition that into organizations and really allow people to be seen in that is the way.
Wow.
And I appreciate you highlighting that for us today. I look forward to being a part of this doctoral study. Peaks has always been a huge fan of what you do and how you do it in a very sincere, vulnerable, and authentic way. You are a titan in this industry, and I'm grateful that you graced us with your presence today, my friend.
Thank you. We're going to change it together.
Let's do it. Awesome. Thank you, man.
Thank you.